Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare. Hey everyone, Bradley Bostic here. Welcome to our next episode of Boombostic Health in the Wild here from JPMorgan Healthcare 2025 in San Francisco, where thousands of people, mainly in blue suits, descend upon the city to talk about healthcare. And I am lucky to be with Jeff Fischer, who I've been talking all day as well, so my voice is dying. So hopefully I'll let Jeff do most of the talking. But Jeff is the president of Longhorn Diagnostics, right?
Correct.
Yeah. And are you a Longhorn? Did you go to UT or something?
I did. I got my MBA at the University of Texas.
Okay. So you go, it's like the Hook'em horns?
A little bit of that.
Okay.
Yeah.
You're a fan?
Yeah, definitely. It was disappointing last week.
Yeah, well, they've come a long way though, you know. So I used to never admit this, but I played football at Indiana University.
Oh, wow.
And
what an amazing season.
Yeah,
you guys
so I lead with it now.
Yes, absolutely.
But yeah, I went to the Michigan game in Bloomington. And so it was like the first time and maybe only time when IU was favored over Michigan, and we won.
And you won.
It was amazing. And when I went to school at Indiana, nobody really came into the game. They just tailgated. It was like the most raucous, tailgater crew. Now everybody's in the game, sold out, so cool. And then I went to the game against Notre Dame, which clearly Notre Dame won pretty decisively, but it was respectful. I think IU is a little bit starstruck, frankly.
Yeah.
Like, whoa. So cool. I like Texas too. I would love to have you just introduce yourself. First of all, why'd you get into healthcare? I know we're just doing this quick 10, 15 minutes. So, but just, why are you in healthcare? What's a little bit about your background? And then what are you doing now?
Sure. So I was never expecting to get into healthcare. My father's a physician and was pulled into biotech through a discovery that he made in the clinic. Okay. And so I kind of grew up watching him build a biotech business, but having really no interest in biology myself, I never saw myself coming into the field. But I went in the Marine Corps. I was an infantry officer in the Marine Corps out of college. I then went back and got my MBA at the University of Texas.
And how long were you in?
I was in for 4 years. Okay. But, and really pretty much a calm period of time. So I didn't,
you weren't
not in really any of the major combat times. We were there. We pulled the U.S. Embassy out of Somalia, but that really was not much of a deal. So,
got it. But thank you for your service nonetheless.
I appreciate it. But when I was at business school, I was looking at different options, mainly in finance. And my father called me and asked me if I would come and help him spin out of another company.
Okay. And so your father was an entrepreneur in healthcare.
And so he was. And so I saw a great opportunity there, both to work with my father, but also to kind of have the opportunity to do something at a very high level very quickly. And so that's what brought me into healthcare.
That's amazing. And I'm sure your military background had to help you somewhat with the discipline and the leadership qualities. I mean, did you learn some things from that you translated into business?
Where that really helped was in 2020. We had built this company starting in 2006 and really got in a nice position, but we weren't really growing where we needed to be. And then in 2020, our lead commercial product, PrimeStore MTM, which is a sample collection technology for molecular testing, had just been cleared by the FDA a year and a half before. And then all of a sudden, we got a call from the FDA in February of 2020 and said, you need to start ramping up because this pandemic is going to happen.
Okay.
And there was very little sample collection inventory available, and the standard technology that was being used at that point was really hard to scale. And we were a chemical solution, and we could scale quickly. And so we went from doing about 30,000 units in 2019 to doing 25 million units in 2020. And so all of that was being done under lockdown in a position where we couldn't go meet with manufacturers. And so a lot of my Marine Corps training of kind of how to deal with chaos really kind of
You were able to stay calm and keep people moving forward.
Yeah, we could just make decisions very quickly. And
when somebody came into your office and said, "Sir, I didn't sign up for this," you say, "No, you actually did sign up for this, and here's what we're going to do to make it happen."
Well, and I also had a great team, and that was one of the other things I learned in the Marine Corps is that if you have a good team, you trust them to do what they do, and you don't have to do everybody's job.
Yeah.
And so you're better not doing their job and letting them do what they do best, and that's what my team did. And so we were really able to meet the demand and play a huge role in the beginning of the pandemic.
Okay, so boil it down for the audience of largely we have entrepreneurs, business people, investors, people that care about the business of healthcare and about innovating in a way that aligns the right kind of economics with that innovation so you can sustain that and drive it into the market. So talk just in really fundamental terms, what does the sample collection technology do exactly? How does it work?
So what made it different is, so for molecular testing, when the molecular field started to take off, they were really growing out of an old technology, a way of keeping samples intact for growing them. But you didn't need to grow them anymore for molecular testing. You just needed to get to the nucleic acid. And so the problem was that nucleic acid starts to degrade as the sample moves from the human body to a laboratory to do testing. And so the current technology was there to try and keep it alive and keep it intact, but required a lot of refrigeration and really had to be kept very careful for a very short period of time so you could get it tested.
How short of a time?
Generally 24 to 48 hours.
So you had 24 to 48, and if it didn't get tested, you had to redraw?
The sample was ruined.
And we're talking about blood samples.
Well, no, in this case,
tissue
respiratory samples.
Respiratory, that's what I'm trying to get to. Is like,
swab,
yeah, break it down. Okay.
And really that was true of a lot of samples. Anything that as it comes out of the body, it starts to immediately degrade. Blood, really stool, all
so
of
this
these
we're
samples.
talking about specifically respiratory samples during the pandemic.
Correct. And
so people are getting is this where you're doing a swab?
Exactly. What we all had to do many times, especially in the beginning of the pandemic.
So the swab gets jammed in your brain, and then it gets taken out, and it not actually
and it goes
your brain,
in,
but
well,
you
sometimes
know, it feels
it felt
like it.
that.
Yeah.
In fact, a good sample was supposed to touch
way up there.
Yeah.
And then it goes into this device you had.
Correct.
That extended it to from 24 hours to how long?
Really up to a month.
Wow.
And not only that, but it took a sample that was infectious, and especially in the beginning with SARS-CoV-2, we didn't know how infectious, how dangerous. So it immediately rendered it non-infectious. So it could go into a lab and people could work on it without having to be with all of their PPE on or having to go under a containment hood. And so what that allowed was, first of all, samples could be moved easier. It didn't need to be refrigerated, didn't need to be packaged in a way that if somebody along the way were exposed to it, they
so
would
it
be
streamlined
infected.
that whole process,
and
from the collection through to when it gets tested.
Absolutely. And then once it got in the lab, it made that even faster. So we took a lab called Aegis down in...
I know Aegis well.
You do?
Yeah, I run a company called HC1 that's the leader in transforming lab data into strategic insight to improve patient outcomes. And so we manage laboratory relationships on over 100 million individuals. So I know Aegis, and very great organization.
So when they started, they weren't sure that they were going to do COVID testing because their employees didn't want to bring this virus into their lab.
I see.
So when they were comfortable that our product inactivated the sample, we took them from being able to do 5,000 tests in a day to being able to do 50,000 tests in a day.
So you inactivated the sample, but also maintained whatever integrity was needed to run a test and get the right result.
Correct. And we made the logistics inside the building much easier. They could remove all of their safety cabinets, which gave them more space. They could bring samples in overnight, pack them as anywhere they could put a sample, and then pull them, run them as soon as the machines were open. They could just keep adding samples in. And so that really gave them the efficiency, and it made the tests more sensitive. So they were getting better results at a much more efficient process. And they were able to get out 15 million tests.
Wow.
And then they went on to sequence another 500,000 of those to see how the virus was changing. And they could do all of that because of the capabilities of our sample collection device.
So when the biography is written about this whole dynasty, it sounds like you and your father and your family are creating, part of that whole couple chapters are about playing a major role during this public health crisis. Is that fair?
That will definitely be part of it. The other side of it is we are also a vaccine company. We develop vaccines. And so when we started this process, we were looking at better testing products, which like our prime store molecular transport media brought into that. But we were also looking for ways to prevent the next pandemic. And so we've been working on a universal influenza vaccine for the last 15 years, which we believe we're getting very close to. Taking a different approach, instead of going after a single component or trying to go after whichever strains are circulating today.
Yeah, because usually you miss the strain or only partially get it or whatever, so it might not even help.
Correct. And so right now, they say that this year's vaccine may only be 25% effective. And so it's not unusual that people are opting out of getting a seasonal vaccine, especially if you're a generally healthy person. It's not that they're concerned about it, but it's just kind of like,
What's the point?
Why would I
When
take
it's
the time to go
75%?
do it?
Yeah, I mean, at least if it gives me a 50-50 chance to be healthier. So are you internally funding all of this? Do you have outside investors? How does the business side of this work? Because taking 15 years in something that's probably still not generating revenue, like that's a big investment.
It is. And so we've put a lot of our own family money into this. And then we had revenue from the COVID years from our diagnostic side. But we're getting to the point with that universal vaccine, the monoclonal antibodies that are associated with it, as well as some work we're doing with sepsis and really looking at maybe bringing in outside money for the first time to really push and drive the clinical development of that side of the business.
Is sepsis a diagnostic that you're working on or what?
Actually a therapeutic, a way of preventing sepsis. So treating the infection at an earlier stage and or maybe even preventing it altogether by putting on antibodies with extended half-life that can be put on before a surgery. If you come into the emergency department with traumatic injury, being able to put that on and have it cover you for the whole time you're in the hospital and maybe the whole time you're recovering from this accident. And so we think it's really an exciting opportunity.
That sounds incredibly exciting. I haven't heard of anything like that showing up for sepsis. It's a scary issue.
And we've been working on that prior to this company. We had a previous company. The company that I came to work with my father, we were doing bacterial infections. We sold that company in 2005. So this is really building on that work. So this is something we've been working on for the last 40 years.
Okay. It's not a new thing for you.
Not a new thing for us.
Okay.
So
40 years, that's pretty material amount of time.
We have the expertise on it. This is an area that we're really confident in. And we think the approach we have could go beyond sepsis into inflammatory disease in general and may play a role in things like Alzheimer's and Parkinson's disease and some different types of heart disease as well as even some cancers.
Like inflammatory issues, that sort of thing. Okay, awesome. Well, I know our time is short. I would love to unpack this more in the future. Would love to have you sometime in the studio, maybe even coming to Chicago.
I would love it.
It'd be fun. Well, congratulations on the amazing work that you're doing. Thanks so much for being part of the Boombostic Health community. And thanks everybody for joining us here on location for Boombostic Health in the Wild at JPMorgan 2025 in San Francisco. We'll see you next time.
Great. Thank you for having me.